Good morning. Good morning. Welcome to the full Health and Human Services Committee meeting. This is part two of a quadruple header today for Health and Human Services. We've got quite a few meetings. We've already had health professions. We have the full now. We'll be followed immediately after this by health. And then we will have another health meeting, health subcommittee meeting this afternoon. So thanks to everyone for being here. And with that, the clerk will put us up on the roll. Okay, we've got a quorum. I'm going to kick us off this morning with a welcome. We have Delegate Ren Williams as our newest member. And Delegate, thank you for being here.
Thank you for having me.
That's cool. I heard some moans. No, this is good. This is good. That was coming from... we have a lawyer. That's it. That's right. No, Delegate Williams has a lot of passion in healthcare. I know you've spoken... You worked on a lot of bills related to healthcare, so it's great to have you on here. So thank you to do that. With that, we're going to jump right into our very full docket here. We are going to do some block votes today, so bear with us as we get those together when we do get to the block votes with our ACE committee chairs reporting out. But before that, we have two bills before the full committee. We could start, I guess we could probably do both of these, but let's start with Delegate Hodges. You've got HB 1109.
Sure. Thank you, Mr. Chairman. Run down here.
That'd be great. Thank you.
Good morning, Mr. Chairman. Been a fun morning. So, House Bill, excuse me, House Bill 1109 requires the Department of Medical Assistance Services to develop and manage care organizations and pharmacy benefit managers to comply with standardized methodologies for the collection and reporting of data related to expenditures, rebates, and the source of all cost components to the Department of Centers for Medicare and Medicaid Services. The bill requires managed care organizations to solicit and undergo an independent audit of their reporting practices every 2 years and directs the department to establish a compliance unit that may impose penalties of non-compliant managed care organizations and pharmacy benefit managers. So let me kind of explain that, Mr. Chairman. We actually there was an independent study this past year that we had worked with some folks, and we were able to get down to pharmacy claims data. Actually, the claims data that pharmacies were paid and then the federal match. That looked pretty good. I mean, I wouldn't say good because you're paid below cost oftentimes, but we were able to look at that. But then you look at what is reported from the PBMs back to Medicaid. In 2023, there was a $2.9 billion difference. $2.9 billion with a B. So something's going on there, and basically what I believe is going on is, those costs are going into the capitation rates and inflating our capitation rates. So you're looking at the MCOs coming to Virginia now and looking for close to, $3 billion, I believe, to make them whole. And actually, I have put in a budget amendment in the first year with a single PBM for $1 billion in savings, and the second year, $1.8 billion in savings. There is a cost for developing a non-compliance unit within Medicaid of $200,000, which is very small compared to the billions of dollars. And when you look at this, I mean, basically we've done work in the past on spread pricing. And to tell you honestly, I was one of the first in the country to actually find spread pricing. And, we were able to find $80 million like that in the Medicaid system on spread pricing. So this is basically the same thing because we have inflated rates on the back end from the PBMs. So basically, this bill provides transparency, and the key points of the legislation are standardization of methodologies. There are data content requirements. And I mentioned the transparency. There are independent audits. It establishes a compliance unit. And pretty much that's the bill, Mr. Chairman. And I would hope it would be the pleasure of the committee to report this and move it to appropriation so we can really take a closer look at this and, save the Commonwealth a significant amount of money.
Delegate Hodges, thank you so much. And as you noted, if we do move to report this will go to appropriations. Any questions from the committee or the patron? Hearing none. Anyone here to speak in favor of the legislation? Come on up.
Art Kellerman is a former health system CEO, academic physician, and health policy practitioner. This is a fantastic bill. It's critically needed. The dollars are not unrealistic. I strongly recommend that you support this bill.
Thank you.
Good morning, Mr. Chairman. I'm Cal Whitehead with the Virginia Community Pharmacy Association. You all have done great work in this area in the last few years, and you continue to do so this year. Delegate Hodges is right. This is a great bill for increased transparency. More information is better. It's going to help you all do your job better as legislators. It'll help the agency do a better job, and it'll ultimately help healthcare providers like pharmacists and also patients. We urge you to support this bill. Thank you.
Thank you. Anyone to speak in opposition to the bill?
Mr. Chairman, Doug Gray on behalf of the Virginia Association of Health Plans. We take issue with including the managed care organizations. This body has already decided to do a single PBM. We don't see how you could stand this up and make any difference at all in that short a period of time between now and a single PBM. We also take issue with the representation that there is a magic pot of money out there. These advocates and this legislator and others have asserted that there would be hundreds of millions of dollars in savings from a single PBM. You spent $1 million on a study this last year. The results of that study are that it does not. In fact, it's less than 1% savings. Their suggestion is that you might save $20 million out of a $2.6 billion program. That is an independent study by an entity that did the studies in the other states where they have a single PBM, not the health plans. It's irresponsible to continue to suggest that there are savings when there aren't. And that's the problem that we're having here. People need to respect the facts. And the facts are coming from your own studies. It doesn't really make sense to include MCOs in this. If you want to do this with your single PBM, go for it. In the end, you're going to end up owning the risk and the costs.
Thank you. Anyone else to speak to the bill? We'll bring it back to the committee. Any questions for the patron?
Can I have final word, Mr. Chairman?
Please go ahead, Delegate
Thank you,
Hodges.
Mr. Chairman. And some of the comments regarding a single PBM, that was a totally different study. These are actual numbers that were reported to CMS, because if you look over here, this is what the pharmacies were paid. Then you look over here on the other arm of CMS, this is what was actually reported to CMS by the PBMs, and it's verifiable data. And 1 + 1 equals 2, Mr. Chairman, and we know that in appropriations. 1 + 1 does not equal $2.9 billion in 2023. And over the course of 2017 through 2023, what was reported to CMS, where they developed the capitation rates, there was a difference of $10.9 billion. So the study that they're looking at with the single PBM has actually nothing to do with this, because this will filter down to the single PBM and require a single PBM to have that transparency is what we need, because a single PBM could still do this. So that's the reason for the legislation, Mr. Chairman.
Okay. Thank you. If no further questions, we'll take a motion.
Mr. Chair, I move to report and refer to appropriations.
Second.
We have a motion that's been properly seconded to report and refer to appropriations, HB 1109. Go on the board.
Nope.
We'll let you come up. And HB 1109 will report, refer to appropriations by a vote of 18-0. Thank you very much. We're going to go ahead and jump to the Behavioral Health Subcommittee report from our wonderful chairwoman, Chair Price. I'm sorry, no, yes, Chair Price, Chair Gardner. I'm so sorry. So Chair Gardner, we'll go ahead and jump into your report.
Thank you, Mr. Chair. We'll start out with HB 610. It requires that it establishes a Commonwealth Food Security and Coordination Act to coordinate state-level food security responses during federal nutrition benefits, interruptions, natural disasters, and other emergencies affecting household food access. Under the bill, the Department of Social Services, the Department of Agriculture and Consumer Services, and the Department of Emergency Management are directed to work together to coordinate the provisions of the Act. The subcommittee recommended reporting and referring to appropriations 7-1, and I so move.
Second.
We have a motion that's been properly seconded to report, refer to appropriations, HB 610. We'll go on the board. And HB 610 will report, refer to appropriations by a vote of 12-6.
Thank you, Mr. Chair. HB 656, the Uber Chairs Bill, Delegate Willett, directs the Department of Health to issue regulations that include quantitative network adequacy standards for timely access to care, time travel, and geographic distance that are at least as stringent as those imposed for qualified health plans and qualified dental plans. The bill amends the definition of mental health services and substance abuse services for the purposes of health coverage insurance. The bill requires health carriers to submit all comparative analysis prepared pursuant to the federal law to the Bureau of Insurance on the date and frequency as specified by the Bureau, includes additional information to include in such submission. Under the bill, the Bureau may impose a penalty not to exceed $100,000 for non-compliant and insufficient comparative analysis or require, a carrier to remove, revise, or remedy non-compliant treatment limitations. The bill, finally, the bill authorizes the Bureau to promulgate regulations as necessary to implement the provisions of the bill and directs the Department of Health to adopt emergency regulations to implement the provisions of the bill. The subcommittee recommended reporting with substitution 7-1, and I so move.
Can we get a second on that substitute?
Oh, I'm sorry.
That's all right.
Can we get move the substitute?
Second.
We have a motion that's been properly seconded to report the substitute. All in favor say aye.
Aye.
Any opposed? No. So that's before us, and then we'll take a motion on the bill itself.
I recommend reporting. It was recommended 7-1, and I so move.
Second. We have a motion that's been properly seconded to report with substitute HB 656. Go on the board. And HB 656 reports a substitute by a vote of 17-1.
Thank you, Mr. Chair. HB 1063, Patron Hodges, directs the Department of Health to maintain a list of agencies and organizations that submit requests for and receive opioid antagonists through its distribution program. It requires the department to submit a quarterly report to the chairs of the House Appropriations Subcommittee on Health and Human Services, the House Health and Human Services Committee, Senate Finance and Appropriations Subcommittee on Health and Human Services, and Senate Subcommittee on Health, and the chair of the Virginia Opioid Abatement Authority on its distribution of opioid antagonists. The committee recommended reporting 8-0, and I so move.
Second.
We have motions that have been properly seconded to report HB 1063, and we'll go on the board. And HB 1063 reports by a vote of 18-0. So, thank you, Delegate Gardner.
Next, Mr. Chairman, we have HB 1391 that reported with a substitute, and I move the substitute.
Second.
We have motions been properly seconded to report the substitute. All in favor say aye.
Aye.
Any opposed? No. So that's before us.
1391, Delegate Hayes' bill directs the State Health Commissioner to establish the Sickle Cell Coordinated Access Network to provide healthcare providers in the Commonwealth with real-time consultation and support for sickle cell specialists. The committee recommended reporting with a substitute 7-1, and I so move. And refer to appropriations. Okay, give me a minute.
We have a motion that's been properly seconded to report with substitute and refer to appropriations, HB 1391. Go on the board. And HB 1391 reports with substitute and will be referred to appropriations by a vote of 17-1.
Thank you, Mr. Chair. And the remaining bills are also sickle cell bills. House Bill 1398, Delegate Franklin's bill. No, this is infant mortality.
Yep.
I'm sorry. Reported with an amendment. I move the amendment.
Second.
We have a motion that's been properly seconded to report the amendment. All in favor say aye.
Aye.
Any opposed? No, that's before us.
House Bill 1398 established the Fetal and Infant Mortality Review Team to develop and implement procedures to ensure that fetal and infant deaths occurring in the Commonwealth are analyzed in a systematic way. The bill requires the team to compile triennial statistical data requiring fetal and infant deaths and to make such data available to the Governor, the General Assembly, the Department of Health. The bill provides that information and records obtained are created by the team, and portions of the meetings of the team at which individual fetal and infant deaths are discussed shall be confidential. The committee recommended reporting with amendment and referring to appropriations 7-1, and I so move.
Second.
We have a motion that's been properly seconded to report with amendment and refer to appropriations, HB 1398. Go on the board. And that carries by a vote of 17-1. Thank you.
Thank you, Mr. Chair. House Bill 1403, also co-patroned by Delegate Franklin, and reported with a substitute, and I move the substitute.
Second.
We have a motion that's been properly seconded to remove the substitute for HB 1403. All in favor say aye.
Aye.
Any opposed? No, that's before us.
House Bill 1403 actually renames the Maternal Mortality Review Team as the Maternal Mortality and Severe Mental Morbidity Review Team. That's a mouthful. And expands the mandate that such team develop and implement procedures to ensure that certain instances of severe mental morbidity, as defined in the bill, are analyzed in a systematic way under current law. Such team develops and implements procedures to ensure that certain maternal deaths are analyzed in a systematic way. The bill requires the team to compile annual statistical data relating to the severe maternal morbidity, including regional and demographic breakdowns of all instances of severe maternal morbidity, and include such data on a publicly accessible interactive data dashboard on the Department of Health's website. The subcommittee recommended reporting with the substitute and referring to appropriations 7-1, and I so move.
Second.
We have a motion that's been properly seconded to report with substitute and refer to appropriations, HB 1403. Go on the board. And that passes by a vote of 17-1. Thank you.
And lastly, Mr. Chair, House Bill 1418, Delegate McQuinn's bill actually directs the Department of Health to establish the sickle cell trait awareness and education program to raise public awareness of and education on the sickle cell trait. The subcommittee recommended reporting and referring to appropriations 7-1, and I so move.
Second.
We have a motion that's been properly seconded to report and refer to appropriations, HB 1418. Go on the board. And that passes by a vote of 17-1. Thank you so much, Delegate Gardner. I know we're moving quickly here, but I did want to pause for 2 seconds. There are some very significant bills in the group we just went through, including several related to sickle cell. And these are really, really important bills, and I appreciate the patrons on this. In this case, Delegate Hayes and Delegate McQuinn. I also appreciate the advocates who have appeared and shared some really emotional testimony, including that came from our Secretary, Candy Munden King. I think we were all moved by that. This will need some funding, and we're going to do our best with our appropriations hats on to work on that. But I really appreciate her courage to come forward and testify on those bills, as well as the patrons and as well as this committee. Thank you for your work on that. With that, we now will turn to our chair, Delegate Price, to talk about health professions. And we've got one bill from Delegate Guzman to address first, and then a block.
Yep. So yes, we have House Bill 413, and the patron does have an amendment.
Thank you, Madam Chair. Mr. Chairman, I would like to move an amendment. Present an amendment for your consideration.
And Mr. Chair, would you like for us to make the motion, or do you want it reported first?
Let's go ahead and report it. Yeah.
Mr. Chair, the amendment that's on line 29 introduced after B, we're going to strike the remainder of line 29 and insert the. So this is just going to remove that entire first phrase under subsection B that says, with such funds as are appropriated for this purpose pursuant to the General Appropriation Act. So that's coming out.
I thought we were in a giant football stadium.
Mr. Chair, I move the amendment.
Thank you. We have a motion that's been properly seconded to move the amendment. All in favor, say aye. Aye. Any opposed? No. So the amendment is before us.
Thank you, Mr. Chairman. With that, but striking that line, the bill will not go to appropriations, and that is the intent of the amendment.
So, Mr. Chair, this bill establishes the high school certified nurse aide training and certification program for the purpose of creating a pathway for qualified high school students as defined by the bill to prepare for and obtain certification as a CNA in the Commonwealth by approving and supporting the establishment of approved training programs with specified standards and reporting requirements. At the time, the motion was report and refer to appropriations, of which the subcommittee recommended reporting on a vote of 10-0. With your permission, I would like to change that motion to report as amended, House Bill 413.
So moved.
We have a motion that's been properly seconded to report as amended, HB 413, and we'll go on the board.
I'm taking this out.
Yeah, I think it's okay. And that reports by a vote of 17-0. Thank you.
Thank you, Madam Chair.
Thank you.
Mr. Chair, we now have some bills that came out of subcommittee unanimously and would like to take those up in block. First, we have House Bill 573 from Delegate Glass, and it directs the Board of Medicine to develop a patient decision checklist for breast implant procedures, including information on the potential risks that are associated with such breast implant procedures and alternative to such procedures. We also have, this one is report and refer. Can we do it?
No, we did. We don't have to refer that one. We're good. You talking 577? Mm-hmm. We're good on that.
Okay. So House Bill 577 requires applicants for licensure for either of the 3 levels of social worker to provide fingerprints and personal identifying information for a criminal background check to comply with changes the FBI requested of the compact member states. And then House Bill 970 provides that any dental assistant 1 or dental assistant 2 may be certified as a preventative dental assistant after completing 1,800 hours of clinical experience and at least 120 hours of didactic and clinical mannequin or human subject training in specified areas under the supervision of a licensed dentist or licensed dental hygienist. And House Bill 1489 expands the reporting requirements for incidents of workplace violence in hospitals by requiring additional reporting requirements such as additional descriptors of incidents, requiring hospitals to report collected data to additional parties, and directing the Department of Health to publish a report containing an annual summary of such data. It also directs the Board of Health to promulgate regulations implementing the provisions of the bill by January 1st of next year and directs the Department of Health to publish its first report by December 31st. So all of those, Mr. Chair, I would move that we report with substitute.
Why don't we do one motion to move the amendments and substitutes?
Can I move the amendments and substitutes for that block?
We have a motion that's been properly seconded to move the amendments and substitutes for these bills. All in favor, say aye.
Aye.
Any opposed? No. Now we'll do it.
Now, Mr. Chair, I would move that we report these bills in block.
Excellent. We have a motion that's been properly seconded to report in block HB 573, 577, 970, and 1489, and we will go on the board to vote in block. And those bills carried by a vote of 18-0. Thank you, Chair Price. Now we'll go to your individual bills.
Yep, and so House Bill 1026 by Delegate Walker permits the Board of Medicine to issue a license to practice chiropractic to a foreign-trained chiropractor who meets certain requirements without examination. The subcommittee recommended reporting with substitute on a vote of 8-1, so I move the substitute.
I have a motion that's been properly seconded to move the substitute for HB 1026. All in favor, say aye. Aye. Any opposed? No, that's before us.
And so now, Mr. Chair, I move to report with substitute, and that was supported on a vote of 8-1.
Second.
We have a motion that's been properly seconded to report with substitute HB 1026. Go on the board. All great. And that passes by a vote 18-0.
Thank you, Mr. Chair. I would like to turn to House Bill 1036, and I move the amendments.
Second.
We have a motion that's been properly seconded to amend HB 1036. All in favor, say aye.
Aye.
Any opposed? No, that's before us.
And so now amended, this bill would allow, the board would permit the Board of Dentistry to grant a license to practice dental hygiene to persons who are eligible to practice dentistry in a country or jurisdiction outside of the United States and who are graduates of a dental school or college or the dental department of an institution of higher education located out of the United States that the board determines is acceptable. And we recommended to be reported with amendments on a vote to 8-1, and I so move.
Before we vote, we have a question from Delegate Scott.
Thank you, Mr. Chairman. Speaking on behalf of a couple of my constituents that raised concern with this, I just want to make it very clear that there are parameters in place for this bill that we're just not granting any license to anybody, but they have to meet the requirements as set forth in our code section in order for them to be granted that licensure. Am I correct in that?
Delegate Tran, do you want to address that question?
Yes, Mr. Chair. Yes, there are very specific parameters outlined in the bill that an individual would have to meet before they are able to practice as a dental hygienist.
Thank you, Mr. Chairman.
Thank you. Yeah, we have a motion that's been properly seconded to report as amended, HB 1036, and we'll go on the board. And that passes by a vote of 17-1.
And next we have Delegate McGuire's House Bill 1522, and that requires nursing homes and assisted living facilities to have and maintain an automated external defibrillator and have staff trained to use such automated external defibrillator. And that was recommended to be, I would like to move the amendment.
We have a motion that's been properly seconded to move the amendment for HB 1522. All in favor, say aye.
Aye.
Any opposed? No, that's before us.
And the subcommittee recommended to report with amendments on a vote of 9-1, and I so move.
Second. We have a motion that's been properly seconded to report as amended HB 1522. Go on the board. And that passes by a vote of 15-2. Oh, 16-2. 17-1. Did I hear more? Okay, I think we'll close the roll on that one. 17-1. Thank you.
And for my last bill, House Bill 1523, I would like to turn to the patron for a potential amendment.
Thank you, Madam Chair. And Mr. Chair, there is an amendment here that we did not get to address in subcommittee, and I'm happy to report that now.
Yeah, please.
So this amendment is actually from the Virginia Department of Health. It just starts on line 25 and after professional strikes and inserts. Qualifications for training entities, limitations on the number of training entities approved by a body approved by the board, and other regulations as deemed necessary by the board to carry out the provisions of this section. This is simply makes the process easier for the Board of Health to create new licenses, and it puts it in line with other processes that have created other licenses in the state.
I move the amendment.
Second.
We have a motion that's been properly seconded to amend HB 1523. All in favor, say aye.
Aye.
Any opposed? No. So we have the amendment before us.
So the subcommittee, Mr. Chair, recommended reporting on a vote of 7-2, and I would amend that to be reported with amendments, and that is my motion.
Second.
We have a motion that's been properly seconded to report as amended HB 1523. On the board. And there we go. We'll close the roll. That passes by a vote of 13-5. Thank you so much, Chair Price. And now we will pivot to Chair Tran for the Social Services Subcommittee report. And I think we've also got a block of bills here, and we're adding 838 to that block. Yes.
Thank you, Mr. Chair. We have quite a few bills to report out today. We will have a block that was uncontested in the Social Services Subcommittee first. Those bills, okay, so that's first is House Bill 632 from Delegate Carlson. This bill establishes a process by which a local Department of Social Services may apply for a barrier crime waiver on behalf of an individual who's been convicted of a Virginia barrier crime that is not included on the list of federal barrier crimes and does not otherwise fall under a barrier crime exception for foster or adoptive homes for the purpose of approval of the individual's home as a kinship foster home. We are also, in this block, would include House Bill 838. And this bill, just a note that earlier we had recommended reporting referring to appropriations, but have learned that we do not need to refer this to appropriations. So House Bill 838 from Delegate McClure adds provisions related to the provision of doula care under the State Plan for Medical Assistance Services, specifying that such care includes support during labor and delivery and up to 2 linkage to care incentive payments for doulas. In this block, we also have House Bill 1060 from Delegate Carlson, which consolidates existing barrier crime exceptions for foster or adoptive homes, including kinship foster homes, and establishes new barrier crime exceptions for certain drug offenses. We also, in this block, have House Bill 1222 from Delegate Delaney. It requires local departments of social services, unless otherwise demonstrated by good cause shown, to record any child welfare interview defined in this bill. And lastly, in this block, we also have House Bill 1495. And this bill directs the Department of Medical Assistance Services to seek the necessary permission from the Centers for Medicare and Medicaid Services to oversee the activities of Medicaid-enrolled service facilitators. Mr. Chair, I would like to move all substitutes associated with these bills.
Second.
We have a motion that's been properly seconded to move the substitutes for this block of bills from 632, 1060, 1222, and 1495. All in favor say aye. Aye. And I'm sorry, let me do that one more time. And adding also 838. All in favor say aye.
Aye.
Any opposed? No. So that's before us.
All right, Mr. Chair, the subcommittee recommended reporting these bills in this block by a vote of 8-0. And I so move.
We have a motion that's been properly seconded to move as substituted the block of bills 632, 1060, 1222, 1495, and 838, and we'll go on the board. And the block reports by a vote of 19-0. Thank you.
Mr. Chair, the next block we reported unanimously to refer to appropriations. So I will go through this set of bills. First up, we have House Bill 76 from Delegate Keys-Gamarra, which directs the Department of Social Services to establish a pilot to issue new luggage to be used to transport the personal belongings of a child in foster care. For House Bill 560, I'd like to ask Council to report an amendment.
As a substitute.
Mr. Chair, Delegate Tran, the amendment for HB 560, or its a substitute, this just reinstates the stricken language that prohibited intermediate relief, and that's located at the end of the statute that's being amended.
Thank you, Council. And this Bill 560 provides that in case decision appeals brought by individuals for themselves or representatives entitled to appeal on their behalf regarding the grant or denial of temporary assistance of needy families, Medicaid, Supplemental Nutrition Assistance Program benefits, general relief, auxiliary grants, or state local hospitalization, the review shall be based upon the agency record. And then we also have House Bill 578 from Delegate Glass, which requires local departments of social services to screen any child in foster care for eligibility for certain federal benefits and to apply for those benefits for which the child may be eligible. The local departments are also required to review existing representative payees to ensure that the representative payee is adequately representing the child's best interests and take appropriate actions necessary to appoint a different representative payee if necessary. The bill also specifies that a local department shall only serve as a representative payee when no other suitable candidate is available, and the bill places limitations on the use of federal benefits by those local departments. We also had House Bill 1174 from Delegate Carroll, which directs the Virginia Department of Social Services to increase the supplemental clothing allowance rate for children in foster care by 30%. We also had House Bill 1511 from Delegate Fagans, which requires the Virginia Department of Social Services to develop and implement the Fatherhood Initiative for the purpose of focusing on the recognition of fathers as essential partners in child and family well-being, addressing a critical gap in family support services, and promoting positive father involvement linked to improved maternal, child, and family outcomes. Oh, and that is it, sir. Mr. Chair, I would like to move all appropriate substitutes for this block of bills.
Second. We have a motion that's been properly seconded to move the amendments and substitutes for this block of bills. All in favor say aye. Aye. Any opposed? No. So that's before us.
Mr. Chair, the subcommittee recommended reporting and referring these bills to appropriations unanimously.
As substituted.
As substituted. 560 was also in that list, yes.
I'm going to ask Chairman for an amendment.
Oh, he did report the amendment.
Yeah. Okay, so we have a motion that's been properly seconded to report the block of bills as substitute and refer to appropriations, and we'll go on the board to vote for the block. And that block passes by a vote of 18-1. Thank you so much, Chair Tran. I think you've got some individual bills.
We do have some individual bills, Mr. Chair. We have House Bill 283 from Delegate Gardner. This bill clarifies that a pregnant woman's prenatal use of an opioid-controlled substance as prescribed by their healthcare provider shall not solely be a reason to suspect that a child is abused or neglected. The subcommittee recommended reporting one moment, please. This bill had an amendment. I'd like to move the amendment.
We have a motion that's been properly seconded to amend HB 283. All in favor say aye. Aye. Any opposed? No. That's before us.
Again, the subcommittee recommended reporting House Bill 283 as amended by a vote of 7-1, and I so move.
We have a motion that's been properly seconded to report as amended HB 283. Go on the board. And that reports by a vote of 17-2.
Mr. Chair, we have House Bill 297 from Delegate Siebold. The subcommittee recommended continuing this bill to 2027. Would you like me to also read the description?
I think that's all right.
That's all right? All right, and I so move.
We have a motion that's been properly seconded to continue HB 297. That's a voice vote. All in favor say aye. Aye. Any opposed? And we will continue that. Thank you.
Mr. Chair, we have House Bill 652 from Delegate Hayes. I'd like to move the substitute.
Second.
We have a motion that's been properly seconded to report the substitute for HB 652. All in favor say aye.
Aye.
Any opposed? No. That's before us.
The substitute is a Section 1 bill directing the Department of Social Services and DBHDS and the Department of Health to convene a work group to evaluate Virginia's parental, prenatal, and postnatal substance abuse services available for the parents and effects on newborn and children. And the subcommittee recommended reporting with substitute by a vote of 7-1, and I so move.
We have a motion that's been properly seconded to report with substitute HB 652. We'll go on the board. And that reports by substitute by a vote of 15-4.
Mr. Chair, we have House Bill 1297 from Delegate Carroll. This creates a central registry of substantiated complaints of adult abuse, neglect, and exploitation to be maintained by the Department for Aging and Rehabilitative Services. The bill establishes the investigative requirements, policies around record retention, disclosure requirements, and notice requirements related to any findings by local departments. The subcommittee recommended reporting as substitute and referring to appropriations. I'd like to move the substitute.
Second.
We have a motion that's been properly seconded to move the substitute for 1297. All in favor say aye.
Aye.
Any opposed? No. That's before us.
As I mentioned, Mr. Chair, for House Bill 1297, the subcommittee recommended reporting with substitute and referring to appropriations by a vote of 7-1. I so move.
We have a motion. We have a motion that's been properly seconded to report with substitute and refer to appropriations HB 1297.
Right. I'm sorry.
Hold on 1 second.
Apologies. I'm sorry, I didn't select the committee. Hang on one second. I knew there was a little. Okie doke.
There we go. And HB 1297 reports by a vote of 14-6. Thank you.
Mr. Chair, we have House Bill 1366 from Delegate Colson. I'd like to move the substitute.
We have a motion to move the substitute for HB 1366. All in favor say aye. Aye. Any opposed? That's before us.
Mr. Chair, this bill grants the Commissioner of Social Services the authority to create and enforce a corrective action plan for any local board or social services or Department of Social Services that fails to administer public assistance and social service programs in accordance with applicable laws and regulations, or takes any action or fails to act in a manner that poses a substantial risk to the health, safety, or well-being of a child or adult. The bill permits similar authority for any local board of social services that fails to provide child welfare services in accordance with applicable law or regulations, or takes any action or fails to act in a manner that poses a substantial risk to the health, safety, or well-being of a child. The subcommittee recommended reporting as substituted and referring to appropriations by a vote of 7-1, and I so move.
We have a motion that's been properly seconded to report with substitute and refer to appropriations HB 1366. Go on the board. And that passes by a vote of 17-3.
Mr. Chair, we have House Bill 1405 from Delegate McClure. I'd like to move the substitute.
We have a motion that's been properly seconded to move the substitute for HB 1405. All in favor, say aye.
Aye.
Any opposed? No, that's before us.
House Bill 1405 from Delegate McClure permits local departments of social services to pay the reasonable funeral expenses of a decedent who was a recipient of social services or supplemental security income. The subcommittee recommends reporting with substitute by vote of 6-2, and I so move.
We have a motion that's been properly seconded to report HB 1405 with substitute, and we'll go on the board. And that passes by a vote of 15-5.
Mr. Chair, we have House Bill 1434 from Delegate Cole. This bill directs the Department of Medical Assistance Services to conditional on the receipt of all necessary approvals and the securing of federal financial participation, implement a provision of payment of medical assistance for nutrition services programs. The subcommittee recommends reporting and referring to appropriations by vote of 6-2, and I so move.
Second.
We have a motion that's been properly seconded to report and refer to appropriations HB 1434. And everybody vote on that one? There we go. And that passes by a vote of 14-6.
Mr. Chair, we now have House Bill 1452 from Delegate Anthony. I'd like to move the substitute.
Second.
We have a motion that's been properly seconded to move the substitute for HB 1452. All in favor say aye. Aye. Any opposed? No. That's before us.
Mr. Chair, this bill directs the Department of Medical Assistance Services to establish an expedited review process for Medicaid service authorization requests involving time-sensitive, life-sustaining treatment when a delay in authorization would pose a significant risk to the health and safety of an individual. The subcommittee recommended reporting with substitute by a vote of 7-1. I so move.
Second.
We have a motion that's been properly seconded to report with substitute HB 1452. Go on the board. And that passes by a vote of 17-3.
Mr. Chair, the last one on our list is, sorry, Mr. Chair.
I apologize. I missed a question. Can we destroy the roll on that one? I'm so sorry. I missed a question from Delegate Shin. I apologize. Let's go back to 1452. Yeah, I have a motion to reconsider.
I move that we reconsider the vote on House Bill, having voted on the prevailing side. I move that we reconsider the vote on House Bill 1452.
All in favor say aye.
Aye.
Any opposed? No. All right, back before us, and Delegate Shen.
I'm sorry, Mr. Chair.
No, I missed you. It's my fault.
No worries. Mr. Chair, I just wanted to explain that I voted no on that bill because it's already something that DMAS does based on federal rules, and so I was confused by how the substitute had language around an expirations. There's a sunset clause attached to it. It's already a rule, and it was unclear to me that whether we would have to pass new legislation every time the federal rule changed, as opposed to leaving that discretion with DMAS to be in compliance with the federal rule. And so that was my no vote, Mr. Chair, and I will remain a no vote on that bill.
No, it's an excellent point on there, and I know we had some clarification. I thought from the patron on that. Why don't we do this? We're moving fast, but I think it'd be better to get it right. So I'd entertain a motion to take this by for the
So
day.
moved.
We have a motion that's been properly seconded to take by for the day HB 1452. All in favor say aye. Aye. Any opposed? No. So we'll carry that by. Thank you so much, Delegate Shin, for flagging that. I appreciate that. So one more bill.
One more bill, Mr. Chair. House Bill 1490 from Delegate Tran. This bill had a substitute. I'd like to move the substitute.
Second.
We have a motion that's been properly seconded to move the substitute for HB 1490. All in favor say aye.
Aye.
Any opposed? No, that's before us.
This bill creates a centralized system for intake for reports and complaints of child abuse or neglect. The bill directs the Department of Social Services to be the agency responsible for the intake of reports and complaints of child abuse or neglect, and specifies that the department shall determine the validity of such reports and complaints. And the centralized intake system would be implemented in a phased-in approach. The bill eliminates the requirement that local departments must be capable of receiving and responding to reports and complaints of abuse or neglect, and it instead requires that any complaint of child abuse or neglect received by the local department shall be immediately forwarded to the Department's of Social Services Child Abuse and Neglect Intake System. Additionally, the bill directs the State Board of Social Services to promulgate regulations to require that local departments of social services respond to valid reports and complaints alleging suspected abuse or neglect of a child under the age of 3 within 24 hours, and investigate and determine the validity of those complaints of complaints alleging suspected abuse or neglect of children under the age of 3 and children with disabilities. The subcommittee recommended reporting as substitute and referring to appropriations by vote of 7-1. And I so move.
Second. We have a motion that's been properly seconded to report HB 1490 with substitute and refer to appropriations. But before we vote on that, we do have a question or comment from our newest member, Delegate Williams.
Yes, question for the patron, if you don't mind.
So, okay, sure, go right ahead.
Yeah, I was just curious, was there issues with like the local department taking the complaints, or was this like an extra layer to help provide another spot to file complaints?
Mr. Chair, I'd respond to the delegate by saying that kind of the intake and follow-up process has been pretty uneven across Virginia. In some communities, it's, I think worked out fairly well. In others, I think there are some issues with the screen-out rates. The national average for screen-out rates is in the 40 percentile, and we are, in the 70 percentile across Virginia. So this bill, now with a phased-in approach, is an attempt to make sure that all kids, regardless of the zip code that they live in, are getting kind of the same standard care across the board when a call is made.
And then just follow up, Mr. Chair.
Please.
Does this tie the hands of the local department? Can they still act like normal, or do they have to like talk to the state or something?
Mr. Chair, I think that this changes quite significantly the roles that the state has versus the local departments have, where we begin the centralized intake process. Right now, calls can be made both at the state level and then referred to the local level, or directly to local departments. So this creates a system where the calls are made and determined that something, follow-up should happen at the state level, and then referred to the appropriate local level. So it does shift a little bit, but I do see that our Deputy Commissioner is in the room and he can answer further questions.
And I just wanted to thank Delegate Tranigan. This is a heavy lift, and it's one of the most significant bills that's before the entire body this year, and I really appreciate our efforts in working with so many folks to get us to a good place with it, so thank you very much. With no further questions, we do have a motion that's been properly seconded to report with substitute and refer to appropriations, HB 1490. Yeah, we had a second already, so we're good on that. I apologize. So with that, we'll go on the board. And that passes by a vote of 14-6. Chair Tran, thank you so much. You had a few bills there. That was a lot. Ladies and gentlemen, with that, we have completed our very full docket. But wait, there's more. We'll immediately pivot to Chair Hope's Health Committee. Yep.
Mr. Chair, I have a motion. I move that we pass by for the day House Bill 851.
Second.
We have a motion that's been properly seconded to pass by for the day HB 851. All in favor say aye. Aye. Any opposed, no. We'll pass it by. Thank you for catching that. Now, with that, we are adjourned. Thank you so much.